New face.
Yeah. But now I'm sitting in a bit more luxurious position than before. So first of all, a warm welcome to my three colleagues here. I'm going to take it easy, so I'm going to ask yourself to introduce yourself very short and sharply, and then we will start with a couple of questions. Yeah, please, sorry.
Hi, everyone. Hope you all enjoyed lunch. My name is Erica Taylor. I am the Chief Marketing Officer at Genentech.
All right. Hello, I'm Oz. Not like Dr. Oz, but more like the Wizard of Oz. I don't like Dr. Oz. I'm the head of digital marketing at Genentech.
Hello, everyone. Davidek, Global Head of Digital at Roche, and great partners with, obviously, our Genentech colleagues. And since I have a mic, I can do this. I would like to build on the last segment around the Uber question. So sorry, because they gave me a mic so I can actually give my thoughts.
We don't need you. You can leave.
Exactly, I know.
No. This invitation for all of us, right? We don't aspire to be like Uber, Netflix, and others. If you think about Uber, they get you from point A to point B with a good experience. If you think about the field that we play in, think of someone who's trying to get a diagnosis and a recovery and a solution to that, right? So yes, I get the whole thing about the experience and try to be like Uber, but guys, we're not trying to be like Uber. We're trying to be better versions of ourselves, whether it's through research and development, whether it's through the commercialization efforts. But just please have that in mind, right? It's that Uber, Netflix thing, great. The Disney experience, wonderful. But we're trying to help make sure someone gets the right treatment to make sure they have more days on this earth, right? So I just want us to level set there. And since I had a mic, I can respond to that. So thank you.
We could continue like this, huh?
No. Different topic.
No, so we've been talking today a lot about customer experience, omnichannel, etc. We've been listening and hearing a lot of great testimonials. So why not stepping a bit back and reassessing a bit where are we on that journey and what have been the learnings? And more importantly, where are we going to, the directions we are taking for the future? And allow me to fire the first question to you,
sure.
Erica. It's because when we talk about omnichannel, we always say content is the king and storytelling is the queen, but that's easier said as done. So from a marketing perspective, how do you make sure that your organization is getting rooted into that direction? And what have been the main hurdles and how did you overcome them?
Yeah, it's a great question, and it's been really great to see some of the panels this morning and kind of talk about the balance between the people and mindsets that you're working with, in addition to the technology and the tools. And in fact, I would argue some of the harder challenges are actually in, moving people in an organization forward and actually creating a movement. And so some of the, where we are in our journey as Genentech, I would say we're somewhere beginning, middle of that journey. I mean, my role is relatively new, even having someone think about marketing as a function, how we advance it, what that means for transformation. And, this role has existed for 9 months that I've been in it. I would say some of the challenges that, we've encountered along the way are really more rooted in the fact that we have grown up and been successful without having to do this. And so everyone can understand intellectually that what got us here probably won't get us there in terms of our future and our continued growth. But arming people with the tools to do that and the confidence to walk away from what has made them successful throughout their career has been part of the challenge that we're working through.
That's an interesting one, because we're coming back to people, of course, and technology. So, Oz, how does that resonate with you?
Yeah, I can add on top of that, right? One thing, I noticed, I worked at 4 different pharma companies. This is my 4th, right? And there's one thing that is common, which is we in pharma, for, a couple of decades, we had great products that were blockbusters and, they sold themselves. And competition was not as fierce as it is right now. There are hundreds of biotechs, and there's so much competition. You launch a product, and then there's something coming in a month after. So now we're learning we have to be incredible commercially. From my perspective, we have to be incredible marketers, right? So the model of, hey, you have a sales rep, and now they're in marketing, and they're doing well, it's not the same anymore. We have to constantly upskill them. We have to constantly make sure that the marketers are incredible marketers. And they understand, the digital transformation extremely well. I think gone are the days where you say, oh, in our marketing team, we have 10 people. This one person knows digital, so let's make sure that they do it. It doesn't work like that anymore. Everybody has to understand it at that level. Same with content, right? the content creation process or how we create content, it's changing. It's changing rapidly. And some of the examples from Netflix, Disney, sure, we're not going to be like them, but there are things that they do that we can take away from. So I think that upskilling of marketers is a really important one that we should keep an eye on.
Great. Again, people. So people. Davidek.
Yeah, and just to build on that, right? And I think what you guys have done is such a successful job is, to your point, it's just marketing in a digital world, right? Very simply. And I think that's, yeah.
Yeah. So we've been talking from a marketing strategic perspective, the challenges and how to overcome them. But then on the other side of the spectrum, it's about the execution, which obviously became a lot easier with all the technology. So tell me, how do you really drive that it is really getting instilled in the mindset of people? Because we were talking about people have the tendency to go back to the old habits as soon as something is changing in the situation. And how do you measure that properly from a qualitative and quantitative perspective seen?
Yeah, sure. I can talk about measurement for days. This is one of the pillars that I'm really leaning in on right now, because there is this, let's say, misconception that, hey, we have done 100 creatives or we launched 50 campaigns, so it's good, right? And that doesn't mean anything, right? You could launch 1,000 and it could be irrelevant, or you could launch 5 and they could be relevant. And then there's this other side of, hey, you know what? Yeah, I am measuring my campaigns and they're doing amazing. And when I ask the question of, can you tell me more? It's, oh, we have 400 million impressions on this banner ad. Who cares? Doesn't matter, right? Or I have 30,000 clicks to my website. Sure, and I think we have to define, let's say you start a campaign, right? Why are you doing that? We know the ultimate goal. The ultimate goal is for the patients to have that information, for HCPs to prescribe that product. But what is before that? For example, if your product is having a challenge with, hey, you know what, I need more patients to know that there are patients like them, great. Do you have a video that shows other patient testimonials? If they do, great, then that's where you drive your media. Now that's your measurement. If you want to enroll people in a program, great, that is your measurement. I don't think we go deep enough in, hey, media spend, impression, clicks, sure, and then what are these actions that we really need to take so that it leads to a prescription? I think our disadvantage, so when we say we want to be more like Amazon, I get a little frustrated because Amazon sees when you put something into your cart, sees when you buy it, they know they spent 17 cents for something that they made $1 profit on. We don't see that, right? We see this. They click on something, they watch a video, and then they either go talk to their physician or don't, we don't know. And then maybe the physician is trying to prescribe something, but they can't because of insurance, we don't know. So there are a lot of unknowns. The way to go to that measurement level is, one, we do a lot of these and we measure a lot of these and we try to test and control and see which ones are working and which ones are not working. So I would say, to summarize the measurement piece, I think we need enterprise metrics that we can track at the most junior marketers level, but also at the CEO and C-suite level so that we can always see what we're doing in terms of performance.
Okay, so what you're saying is at the end of the day, across the organization, it should deliver actionable insights, which obviously are meaningful in the value creation vis-a-vis the customers.
Yep.
Davidek, your 2 pennies on this.
2 pennies, maybe 1. It depends on the level that you look at it. If you look at it from a global perspective, I love the detail you added there, but then even take it up a step further from leading the lagging indicators, right? In theory, that should then roll up into, all right, were we able to launch more products at scale? Were we able to create some kind of customer satisfaction at scale, let's say for our top 5 to 10 web destinations, right? Are we driving impact through that? And then lagging is, all right, from a P&L perspective, are we meeting the OpEx to sales efficiencies? Is there things that are in place? So there's different ways in which you can measure. I think the biggest reality I think we all see is we don't necessarily even go into those agreements or directions of transformation programs with a clear understanding of what we're trying to get out of it, right? And I think that's the aha moment you usually have is like, yes, we're doing all this for what? Because I think the first part of your question was around the technology investments and things like that. And you mentioned that, I forgot what you said, something around, technology is so, but like, I think the overuse of technology is actually killing us.
Yeah.
Because there's just way too much infrastructure, there's way too much integrations, APIs to manage all this. I think we actually need to go back a little bit and use less, but use it really damn well, versus layering all this other stuff. And again, this next generative AI wave is going to add even more complexity on top of all these common and core tools that we use, which is going to add even more complexity on the metrics in which we measure. So it's just some thoughts that were going through my head as I was looking at the lights.
I think you also have to have the incentive structures aligned. I think part of the challenge that we're trying to do is you have, traditionally, marketers are rewarded by creating more things. Not necessarily whether or not those things have impact, because to Oz's earlier point, when you're making great drugs, you're going to have impact, whether you're impacting it or not. And so actually trying to shift some of the incentive structures to talk more about impact and less about what you're making. But when you think about the entire ecosystem of what we're doing in marketing, well, that involves your external agency partners that are also incentivized to charge you time and materials to make more stuff, whether or not it's impactful. Marketers get promoted based on that. Like, there's a whole kind of machine built around the way we work that you can't just change one part. You have to start to dismantle kind of piece by piece.
At the same time, if I understood correctly, keeping it as simple as possible. So it's stripping down the famous cockpit of the Boeing or the Airbus. Could I summarize it by saying that at the end then we should refrain of the I would like to have and just stick to I need to have?
I would change it even more. Because I want to add to what Davidek mentioned, right? What I see is there's a technology, we get so excited about it, and we say, can I use this for something? And that's not the right question, right? The right question is, I have this pain point. I have this point in my customer journey where I need to do something. Or there's this opportunity. What can I do? And then we can find solutions. I mean, my training is in computer science and engineering. Let me tell you, the technology part is the easiest part. It really is. There's a technological solution for almost everything now. So when somebody comes with, hey, I want to use ChatGPT for something, and I say, no, that's not a good solution, right? You should come to me with, my brand is having this problem. So I don't want us to be technology driven. I want us to be, this is the problem, and then technology helps us in a way, in a deliberate way.
I think that's the right place to put it. So Davidek, you've been in many places, structures and etc. And
is that good or bad?
It's very good, you will hear. But I hear many times that technology and the era we are living today is really helping big organizations to drive harmony across the organization. But on the other hand, I hear also that a lot of countries and regions have their particularities. Real or not real, that's another kind of thing, because we live in a world of perception. So at the global level, how do you drive that, and do you make sure that no one is left behind? Because we are talking about huge investments, obviously. I'm not only talking about technology, but also the cultural change, the people, the skills needed to achieve that.
You give me that question, huh?
You deserve it.
All right, there's so much in there. Let's start unpacking that. In regards to the global investment, specifically around some of these spaces like the technology, or even the capability building that we have in and around that, there is a fundamental question of, we do realize there needs to be common and core across affiliates, right? Let's talk ex-US. There has to be common and core, right? In order to have scalability. I think a lot of that is around, can you scale it or not, right? Because if you look at individual countries, right, there is good ecosystems that they've built in there. But as you progress over time, it takes time, money, and effort to keep those ecosystems running, whether it's the data infrastructures underneath, the technology that's doing that, or the capabilities those people have to input data into the systems to try to drive that. And what we've noticed is the fact that in this company made this decision a while back that we need to have common and core across multiple areas. Now, within that, there has to be a focus on the people of creating a culture of wanting to leverage these systems to become better versions of themselves. And what do I mean by that is, you have to create a culture of wanting to put data in the system or even use it, right? And that is huge. And that is a huge mindset. And some people don't want to sign up for that. And I think that's okay. That's up to them, right? And it's not a threat. And a lot of people sometimes reverse back. Even if you look at our leadership structures within the countries, we're all about people, and that's how it should be, right? It's about empowering our people to do more with less. But with this large investments in these technologies, the ability is if we do this correctly, it's going to help us get more medicines out there at scale. We're going to be able to see across the board apples to apples. We're going to be able to see, we talk about qualitative or quantitative ways in which we measure customer feedback. And by customer, I mean patient or healthcare provider. We should be able to see that across the board, right? And I think that's why the investments need to happen. With that said, it's not easy, right? It's not easy. It takes time, and this doesn't happen overnight, guys. This takes years. And by the time you probably figure it out, it needs to update itself again as well. Mm-hmm. So that's why I say be agile, build on little wins that go far. You don't need to go to these big, hairy, audacious goals. Be clear in the direction that you're traveling as an organization, but bring it back and like with these little wins, right? Yep. If we have a simple way of understanding outside of our face-to-face interactions globally, how do we communicate with customers and how do we communicate with us as a company? It sounds so freaking easy, but you'd be surprised. I don't know if you can raise your hand in the room how many people have done it, but it is almost impossible to achieve at scale across hundreds of countries. So I didn't answer your question, but I just gave kind of a blurb of what was on my mind. But hopefully someone finds it somewhat relevant, right?
I do want to add something to the transformation piece, though, right? Because you said, look, I hear people saying, oh my God, another transformation. Yeah, you have to transform all the time. It's not like we're transforming now and then we'll stop, right? It's not like we're going to be great in omnichannel 3 years from now and then we'll say, okay, I guess we're done, right? It never ends. Yeah. So I think we're trying to instill this mindset of, yeah, transformation is happening every single day. And you have to be good with change. You have to be good with transformation. If you don't want that, this is not the job, right? Pharma, other industries like marketing, medical, these things are changing every single day. So transformation, I think we need to find a different name for that. Or when we say things like future of marketing, it's not the future, it's right now.
Yeah. Erika?
No, I double down on it. I was just joking, like the concept of change and how that sort of, some people run toward it, some people kind of shy away from it. I think one of the things that's different is the pace of the change. I think we can all accept, again, that change is constant, but what is happening with the new tools and technologies that are available is that change is happening faster for an industry that used to be on 10 and 15-year arcs of change. And so I think part of the adjustment is we're having to go faster in order to meet our customer and patient needs. But before, science is still very slow, right, generally speaking. And so we're having to kind of deal with this dichotomy of slow from an R&D engine perspective, but speed when you're actually trying to get things to market and get patients access.
Yep. Great.
So I have one more question before I open the floor for other questions. Imagine, I'm not John Lennon, but imagine that tomorrow all data are shared because we say data is a new gold, is a new oil. What would that mean for society? If all companies which are sitting on their pile of data, gold, would open up, and I know there are a lot of compliance, and let's forget about it for once. We have the luxury here to just brainstorm.
Sorry, what type of data? Sorry, I mean, you're talking early drug discovery, like commercial, go to market?
No, let's say data that you capture in like any kind of CRM system.
Okay, thank you.
Yeah, so nothing about your products as such, but really about what do we know about the people we interact with?
I don't see a positive. So it's positive, sure. I don't think there are any organizations that are ready to use that data and say, you know what, I am getting so many insights from this. I think for the first 6 months, everybody will be confused, right? We'll be like, oh my God, this is so much data. Because the problems we're talking about right now is we have a lot of data, we don't know how to use it. Now multiply that by 100. I don't think we'll know how to use it. If we knew how to use that, then yeah, that's another step for personalized engagement, right? Because now you have all the data you want, and you have, let's say, 250,000 interaction points where now AI can come in, right, and can tell you, you know what, these types of physicians, we cluster them into one based on this data that we're mining, and we know that the next message that they need to receive should be about this or that. That's what I see as like the biggest step. But I think we need to find out how to do that first within our own data sets.
And plus, it's a bit coming back to the Uber kind of idea. Is at the end of the day, also it could mean what could you do for patients by leveraging on data which are sitting somewhere in one company and are not always accessible by another. But okay, Some food for thought, as I said. Maybe time for 1 or 2 more questions from you at the other side.
It was so clear you have no questions. Perfect.
There is one question. Difficult to see.
Oh, this guy has
Thank
good
you.
questions.
Not too many. No, it's just like, I don't know, like I hear a lot about, there's a, it's difficult to deal with the pace of change, like the amount of data to collect and CRM system, omnichannel. But I know as one of you said, we really need to have great marketeers in our businesses. And I'm just wondering, like, is it really a problem that there's a massive pace of change, or is there a problem that there is a lack of fundamental understanding of digital inbound marketing? And that if the marketeers in pharma business had a fundamental understanding of inbound marketing and CRM, a lot of marketers that I work with don't know how to use, have ever seen their CRM system. If that understanding was there, would the pace of change be easier to keep up with? What do you think about that?
I think potentially. I think one of the things I spend a lot of time thinking about is what is the profile of the marketer of the future? I think a lot of organizations here have marketers that either came up in sales, I came up in analytics and sales, and then moved into marketing, and those are all very useful backgrounds to have. I think, and my belief, at least within our organization, is that we can upskill marketers to understand things digital and how to do this well, mainly because they're consumers of it. Right? I joke with our organization, I'm like, you guys live a beautifully omni-channel life through your phones as people, and then you come through the turnstiles of the building and you make the same print piece we've been making for 15 years. Right? So there's a lot of direct experience that we all have, I think, as consumers, to be able to upskill them. When I think about the talent I want to bring into the organization, it's likely coming from other industries. I feel like a lot of what we're talking about here in pharma has been bread and butter marketing literally anywhere else. And so I think about the different kind of talent profile that we want to bring into the organization to help with that upskilling.
Yeah, if I can quickly answer that. So I think what we're trying to do is jump from little foundations or fundamental skills of marketing to now let's do omnichannel or now let's do AI. We don't even know how to create good content for a social media channel, for example. We don't even know how to measure like basic campaigns. So I think that layer that is in between, it's not as exciting. It's a little bit boring, but I think we need to focus there so that we can do that next step. We're trying to build a building like windows in a beautiful way. We don't have the foundations.
Yeah. Before Dario gives me an angry look, I want to thank Erika, Oz, and Davidek for the interesting exchange. Wishing you all a very nice continuation of the conference. Thank you.
Thank you very much.
Thank you.
Thank you.